It is now 10 o'clock and we are coming back into session with our first group, No More group from Mason County.
I had to actually ask what this was because it says no more presentations. I thought, well, that's a good thing on our agenda. Didn't know it was no more. The group was just no more presentations.
Oh,
Okay.
no more, yeah, no, this is, yeah.
Take it away.
Okay, Bill.
Hey, good morning, Commissioners. I'm Bill Hyatt. You know me from many, many different references here in Mason County. We started over a year ago, seeing garbage alongside of Highway 3. And I joined the group to go ahead and help clean up. That's where I met Dean Jewett. And then I shared the information that I found at the Sheriff's Breakfast up at Spencer Lake, and Dave Mortensen went ahead and joined our group. And I've known Dr. States for a number of years. We started cleaning up at the encampment down there. We realized that we could not go ahead and get to everything that was up there. So we started looking at a different method. We created a coalition called No More. We picked up over 80,000 pounds worth of garbage there before we broke away from our group to go ahead and focus more on what's going on here in the Mason County. This is what's up on the hill that most people don't see. That's actually a stream bed that you can see the culvert that dumps right down into Oakland Bay.
Okay, just another picture here. You can just see the sheer volume of what we have on the hill, and you can see there that somebody's actually dug into the bank and totally started to landscape that, which is something you don't want to do. We probably flip over to the bike chop shop. You see these messages on social media about people missing their bikes. Well, there you go. Pick a bike. You got it there. We've got just another one here along the highway. And I can say a million things about these pictures, but pictures actually do speak louder, 1,000 words. So we just take a look at them and see what we're bouncing through. I'm just gonna have Dave kind
The
of
one
flesh.
thing that was unique about this, because Dean and I just cleaned this whole area up. It's all about-
Less than a year. So you got the Navy tracks right there.
And it's just more photos of camps. We're gonna go through these pretty quick because pretty soon they start looking all the same. But this is kind of a unique one because you can actually, if you look hard, you can see this from the road, but it's so camouflaged. And it actually has locking doors, 2 locking doors, one right here facing the road and the other around. This is a huge campsite. This one, we couldn't get too close to because I almost got mauled by a pit bull going up here because thank goodness Dean had a stick with him to keep it off, and we had our pepper spray. We didn't have to deploy it, but it came very close. And it's just more. And then one thing we see, we see a lot of carts up there, shopping carts. And these aren't ones right along the road, these are ones that are up on the hill or they're in the water. The last time, we've been up on the hill twice documenting all this. And we
We've got
probably
half
saw
a dozen.
at least half a dozen there and probably more so down below.
And the thing about these carts is Safeway is no longer even offering a bounty to bring them back to them. So every cart that's lost to them is added cost for us to go shopping
Yeah.
at Safeway.
We actually asked to go down and say, hey, this is our group, this is what we're trying to do. Could we, bring your carts back for a bounty so we could help self-fund it? Because we've all spent hundreds of dollars on this project. And there's more bike chop shop. This is unique because this is up on the hill. This is, right below Capitol Hill. And if you notice, the trees are burnt there. And if you notice, so the next picture, you get a little bit closer, there's a bar that goes across the 2 trees. Well, they did their campfire in that, and they caught the whole tree on fire and the ones around it. Those trees are now dead. If that would have got away, it would have raced up Capitol Hill and took out the whole neighborhood up there.
Yeah, there's probably at least a dozen marketable second growth timber that are just gonna dead. They're gonna fall and do whatever they do. But it's just had the fire department not put their lives in in jeopardy going up there, it could have, like Dave said, it could have gone right up the top of Capitol Hill.
And we've cut down full-grown trees up there as well, so Mankey Lumber has been made aware of that as well, so there's full-blown trees that are cut down.
So like Bill said, we started out with a group called Mesa County Cleanup Crew, and then realized it was such a huge problem. What you see from the road is just a small snippet of what's up there. If you get up and you climb the hill, you're gonna find more and more, and realize that there's no way that we could clean it up. How many, Bill? We took
80,000 pounds
pounds
that
of
we know
garbage
of
off there just
that were
on
taken out.
volunteer. So we formed our own group, and our mission statement is educate the public regarding location and problems with illegal camping and criminal activity in Mason County. So, and then to work with our public officials to enforce the laws regarding illegal camps in town and in Mason County. And then 3, educate landowners who have allowed illegal camps on their property and encourage cleanup. So what's our top priorities? First, enforce illegal camping in the city. Inform landowners, it kind of follows what our mission statement is. We want a cold weather shelter. We're not for taking that away. We don't want anybody to freeze, but we do want it in a structured, very structured environment. So maybe Dean, you can expound on that a little bit.
Well, it's just, there's a no barrier, there's a low barrier, and then there's a barrier shelter. There has to be some kind of a unique combination of the above. But to open it up just for, pure chaos, that doesn't work either. So there has to be some controls that are in there. If there's individuals that don't want to comply with that, well, then there's other shelters in other municipalities.
And then one of our goals is to relocate the ETS RV outside of Mason County. We believe that it brings in the element that's not favorable for our community and our town, and we'll expound on that a little bit more later. So what do we do? First off, we observed. Now, we've been on this project for almost a year now. Well, actually, a year.
Yeah, a year.
And first off, we observed that many of the same people on the hill were the same ones that were hanging out at Brewer Park. Okay? And we actually staked out, and we watched the ETS van, and we timed who was going in, how long they took, and what they came out. And the average was,
Just under a minute.
yeah, in and out. So there was no really, there's supposed to be counseling going on, but I don't see how that can happen in a minute. We documented on the hillside, I'm behind my, I bought a program called Onyx X, and we document every campsite with pictures and GPS locations, addresses, the people who own them. Actually, we presented that to you back in April, and we also presented it to City Council. So the idea was thinking that they would use that information to inform the landowners, hey, you got people squatting on your property. I don't know if that ever happened. We were never told. Then we identified, we identified the landowners, we did that, we gave that to you. And then we interviewed the ETS people. We interviewed twice the RV, asked tons of questions. Then we interviewed the Olympia location, the brick and mortar there. And then we had 2 major interviews with the ETS people in Seattle. And the first was a phone interview with the ETS clinic manager in Olympia, and then we did the phone interview at first with Tabia Rose and Sean Soth. Tabia Rose is the head of fundraising and communications, and then Sean Soth is vice president of clinical services. And we actually recorded the interviews with their permission. I have those if you'd like to listen to them.
I've listened to it.
And all our information that we're presenting now is based on those interviews. Okay. So this is a chart that shows you the growth. Now, 2 years ago, when they first brought the ETS van in, that was in December of 2023, right? They were transporting, 30 people were going over to Olympia to the brick and mortar to get methadone treatment, okay? Once we brought in the van, in 2 years, that ballooned from 30 to 130, okay? That's a 333% increase. And then the chart on the far right is they actually saw 240 unique individuals, okay? 130 that they served all the time, but served over 240. So if you do that, that's over a 700% increase from 30. So it just grows. Now, our next chart just shows how it's just climbing incrementally. And it just, boom, 45-degree angle. The longer we provide the services, the more people come. And so,
And these are actually their numbers, not ours. We didn't make these numbers up. They came directly from them, and we pulled their their income tax return. They had an operating budget of 2024 of $42 million. So it's supposed to be a NGO that's nonprofit, but $42 million, it's a lot of money.
so what's this cost us? What's it cost the taxpayer? Well, a daily and annual cost of meds and related services to give somebody a methadone treatment and supposedly the counseling that goes with it, it costs $22 a day, okay? So that's 7 days a week, and if you times that times 130, and that works out to a big number, $1,041,040. Per person, it's $8,000, okay? Now, when you go down to the ETS van, they'll sign you right up for, on Medicaid, okay? So 85% of all those costs are covered by Medicaid because we're happy to set them right up on it. 10% Medicare and 5% are only self-pay.
And just to interject just a little bit there, this does not include any costs of ETS or hospital or anything like that. So you can just imagine what it does to those costs. We actually were able to sit down with the fire department, all three of them, and we got
What's the numbers
yeah,
coming up?
and we got some good numbers with those as well.
Okay, this is screen 26.
What does this cost us as a community? Brewer Park was overrun. We couldn't use it as a city park. Nobody in their right mind would go down there and take their family down there. Open drug use, we saw and witnessed it firsthand. You see it openly used on the street. I witnessed it up by Safeway. I've got pictures of open drug deals being made up on the street. The yacht club camps, the Highway 3 camps, the needles. The needles are a huge problem for us. The huge amounts of garbage, the open defecation, there's open latrines up there with human feces. When Dave was up there cleaning, he stepped into literally 10 inches or more of feces. So that's all running down into Oakland Bay. I mentioned about the needles. We picked up over 2,500 needles. We asked the public health here whether or not we had a needle exchange. We were told no, and that yet they're all the same brand. They're all the same. You see the orange caps there? They're all the same brand.
And later, we did ask again a second time, and yes, there was a needle exchange, but this was from our main health guy. And then, because they're all the same color, they're orange.
The post office is important to me because I have a post office box and I live 16 miles out of town. When I would come into town on my way to Tacoma or visit friends and whatnot, I couldn't have access 24 hours a day any longer. They shut the lobby down because of homeless people camping inside of there, and they actually broke into the mailboxes, the postmaster told me, to steal mail so they could make fires. That's just unacceptable. The businesses, we've got Tozier's. When I first moved down here 10 years ago, I could walk into Tozier's, I could walk into Walmart, and I could walk up to any shelf and I could buy anything off the shelf. Now virtually everything is under lock and key, and Art Tozier told us at a city council meeting that he lost $100,000 from merchandise. It's not because we all decided to start stealing, something changed. Mason County, or Washington State now has the third highest population of homeless people in the country, and that was without King County's count last year.
Okay.
So this is just, we can talk about the needles everywhere, okay? And I'm gonna mention our public health official, Dave Windom, told me directly that we do not have a needle exchange program, and which we all know that we do. But we don't actually have an exchange program, we have a needle handout program, because we collected over 2,500 needles just on the hillside here, and we see them scattered around our parks. Parents find them, and they bring them to people's attention. It just kind of gets swept underneath the rug. So it's something that we really have to get a handle on. People that enjoy the outdoors should not be having to worry about picking these up, or public officials or health people picking these up. They're not all classically trained biohazard technicians. So I would almost imagine that there could possibly be some union rules that that carry over that. So it just concerns me about a liability to our county and city. So
Okay, I think I'm on here now.
nope.
Wait, you're still going?
Yep.
That's Bill. Bill?
No. Observations, based upon our first-hand observations, we believe that most of the clients are not from the local area. That's based upon several factors. Dave and Dean being lifelong residents of this county, they don't recognize half the people here. Dave was a school teacher. Many of these people he would recognize from classes, teaching them and whatnot, and yet we see influx of new people coming in almost daily. There is no end game. The ETS vehicle, they told us that this is basically a maintenance program. It's not a program that they have an end game to go ahead and get people off of drugs, and Dr. States will talk to that in a second.
Yeah, when we asked them, okay, if the end goal is to get people off drugs, how many people have you got off? Couldn't answer.
Couldn't answer us. The problem that we're seeing is we have an overrunning our EMS system. We interviewed the fire department, and we'll have those figures here in a second, but the cost per call and then the tie-up of our emergency vehicles, we only have 10 ambulances in all of Mason County, we're told. And half the time they were over at Brewer Park on a daily basis, sometimes 2 and 3 and 4 times a day. The joke was that maybe they should station a vehicle outside of Community Lifeline because they were going there so often. They have what they call wall time, when they take somebody by ambulance to a local hospital and they have to wait. They cannot just dump them off. They have to wait until equal to or greater than health care is transferred to. The cost to our police, we did a public record request, and there was a period there the police department was going to Brewer Park almost two times every day, and that cost money. I've had friends that have come down to visit me here in Shelton, and when they drive by Highway 3 and they see the amount of garbage and whatnot, it's just not desirable to go ahead and they make jokes about it. And I came from Tacoma, which I know firsthand about the homeless problem in Tacoma. So I saw it. I've traveled extensively in the Northwest. You see it in Portland. It's just not a good place to go ahead and have.
All right, next slide.
This is why I moved to Mason County. I'm a hunter, I'm a fisher. I like to go ahead and go camping. I was raised at your campsites. When you left your campsite, you picked up every bit of garbage that was in your campsite, whether it was yours or not. That was just how I was raised. And it bothered me to see the amount of garbage. That's how I got involved in this in the first place. I saw garbage that was unacceptable to me, and I don't want to be here, I really don't. But I felt that if we don't do it, who's going to get involved in making it happen? Clean water, it's very important to me. Having lived on the water and fished on the water and crabbed on the water, I want edible seafood.
So this is like just some of the pictures that we're gonna kind of
Yeah.
go through quickly, but it just shows you the waterways that we have, and this water is uphill, and it has this crazy thing, gravity, and it goes downhill. So as it goes downhill, it picks up whatever it's gonna pick up. There, with the amount of people up on the hill, probably 40 people, and how much time they defecate and urinate, and you've all heard me say this before, 2,500 5-gallon buckets of untreated human waste going into Oakland Bay and or our hillside every year. It's unacceptable. Next one, Dave. So, do we want a river of water, or do we want a river of garbage and donations and who knows what else? There's a phrase called a church lady. So you go, and it's not really a person that goes to church, but it's like you want to do something good, okay? So you go and you give something to somebody and you feel good about it, but is it actually really doing the end result of what it's supposed to do? You know, you come up here and you look at the hill here and just everything that's scattered around. I mean, there's some areas that we've had to clean up, like this one in particular, as you dive over this hill. What was that, Dave? 4 feet thick? Yeah. So you think that you're done, and you go and grab another piece, and you go, wait a minute, Dave, don't grab that one really hard. Because then as soon as you do, you got to dig down another 3 or 4 feet.
Well, and then there's needles intertwined with it. What we found that there's like brand new sleeping bags on top of brand new, they get wet, they just go get another one, and then they go in tents on top of tents on top of tents.
Right.
Yeah, and brand new shoes, tons of them up there.
Yeah.
And actually uneaten food, cans of food, you know, it's crazy.
You had a coalition of the shellfish that we saw online here. They were talking about the shellfish industry is the #1 employer of Mason County. It's self-explanatory that if you have a lot of species going into the water, you're gonna go ahead and have shutdowns.
Again, that's the spot that Dave and I and a gal named Patsy from Allen cleaned up. But then we come into our actual community and we see, you know, awning camping. You know, these are businesses, people, you know, do a lot of work, you know, they pay their taxes, they do what they need to do, and we have to deal with this, you know, over and over. Shopping carts, you know, we passed an ordinance, but if we have ordinances and we don't enforce them, then why do we even have them in the first place? Okay.
I'm just kind of
Go
breezing through.
blast on the next one, Dave. So this one I want to talk about. I took a lot of heat when I posted this picture on social media. This is a known gentleman that goes into Safeway and shoplifts. And he steals whipped cream. It's not for pumpkin pie. He does whippets, which is very traumatic to the human brain. This person had a dozen whippet cans around him and was passed out, you know, at what levels, for hours upon hours upon hours. Dangerous situations, enabling help to no one ever. We're taking over sidewalks, streets, against ADA violations. You know, where are we at with that? Portland's getting ready to do a lawsuit. It's crazy. We once had a gazebo that was beautiful, put together by civic groups, and it got destroyed. It got destroyed so bad that they ended up tearing the top off altogether as well. So, anyway, you can see what we have with the pictures. Everybody can understand.
And this
it.
is just a very small fraction, and we have hundreds of them.
Hundreds. I got like 1,872.
My wife won't go shopping at Safeway unattended anymore. She's been accosted in the parking lot. She's afraid to go in there by herself, so anytime we have to go to Safeway, we either go to Belfair, or I'll come with her and stand guard while she goes in and does her shopping, and come back with her. She's had to have personnel from Safeway walk her to her car. That's just unacceptable.
So, as a result of this, we have an increase in crime. Am I stepping on anybody's toes
Nope,
here?
nope,
No,
you're
I'm
good. Those are yours.
The degradation of our downtown business core, zoning biz not relocating here, thus lowering our tax base. A strain on our ETS system. Now, from 2023, or excuse me, 1223 to 1225, they had 195 responses to Brewer Park, the ETS people. This came directly from our public information request from the fire department. And so 195 responses. So at a total cost of, come on, screen. Or they did 117 transports at a cost of $1,684 per time, okay? So if you add that all up, that is $328,000 $550 more dollars and change, okay? This does not include the hospital costs, where you can figure it's probably 5 times as much. I don't know that for a fact, but I know it's a lot more. The vast amount of calls to our police and sheriff's department, the overall impact, the reputation, the quality of life in our community. That's what I'm concerned about, you know, because, you know, we started out, I was just gonna pick up garbage for like a couple hours, because I got sick and tired of seeing it. And then once I realized how big it was, that's why we're here. And, let's see. So we go to the next screen here. Okay, so the ETS, we believe, drives many of the wrong types of behaviors we want in our town. In our view, it's not an effective treatment for getting people off a drug. It just keeps people dependent on what considered a lesser evil. There's methadone, Suboxone, I can never say buprenorphine, all at taxpayers' expense. So in the conclusion here, we got all those, and this is a quote from a person we all know, but so although this program was approved before the arrival of the ETSRV, and I think we're all, probably some of you guys were involved in that, but we didn't, it has become apparent the initial hopes for the program have not proved to help our community or our citizens with occupational use or opioid use disorder. It's time to reevaluate its effectiveness and move in another direction, we believe. Now, Dr. States is up next.
Let me switch over to presenting. So I need to get my screen. Go ahead. Let's go back to there.
Yeah, there'll be a thing down here that says share.
Share. Okay, good deal. Okay. And which one was share screen?
Should give you a choice of what screen to share. There you go.
Okay. Then let's get the screen.
You're sharing your screen.
There we go.
Okay, and then we'll move this one kind of out of the way here.
Oh, it's okay.
So I did a whiteboard. It's been about 2 months, actually. It's hard to believe on such a small amount of data. But it's really clear we don't have a model in the country that is consistently used that works for this problem. We don't have that model. So I put, this is actually my own concept of a model, so that we have a way, so that we have something to ground our decisions in. There needs to be some way we can think about this. And so fortunately, we have Casey Whitehouse in our county. We're lucky to have him as a resource, and we've done a lot of stuff with him, and mostly towards the disaster prep side. But I started thinking a lot about what he does, and even though the prescribed burns aren't something that we do a lot necessarily, I think the prescribed burn model is a really good model to think about this particular situation. And full disclosure, in 71 through probably 75 or 6, I helped start the first methadone program and managed it. We ran inpatient, we ran outpatient, we had 20 or 30 therapists, we had kids in residential treatment, we had folks in detox, we had folks in maintenance. I did this. Okay, I kind of know what worked then. The disorder hasn't changed so much, except that I think some of the drugs they're using are much, well, we know they're much more lethal. So from the information that we've seen about other communities, there is a real parallel. The information comes from the homeless that say most folks that are homeless in certain situations have significant substance, not all of them, but significant substance use dilemmas. And we have the difficulty of balancing the health of our clients, our communities, and our businesses. So we've had what is called medication-assisted treatment here. And it can work. We actually have 3 examples where treatment for this does work, and we'll talk about those in a little bit. That medication-assisted treatment, when it's delivered into the chaos of homelessness, where there's minimal structure and accountability for clients, therapists, program managers, community, and legislature. This isn't just a problem with the people on the Hill. This is a problem all the way from Olympia, coming down from the legislature. It behaves like starting a fire with no containment plan. That's what dispensing meds does, is we perpetuate a system. And so what I decided to do was compare a controlled burn with SUD treatment systems and how that might apply to Mason County. Now, the big thing about a controlled burn is that there are boundaries. You know, when I first started studying controlled burn 2 months ago, I downloaded whatever I could from the web. The forms to do a controlled burn in Texas, 12 pages. You really have to have a lot of systems, and not just systems, but people scheduled. You have to have the right weather. You have to have the right backup, plan B and plan C, da-da-da-da-da-da. And I thought, well, this probably isn't such a bad way of looking at things. The other thing I know is that this is a really serious illness. Substance use disorder is a really serious illness. Those people are so disabled, and this is not a put down. They are so disabled. I've treated them, I know, that they're unable many times to think clearly. They really can't set their own boundaries. They can't commit to treatment. Years ago, when I left my fellowship in adolescent medicine at USC and started doing multidisciplinary care in Spokane and also helping with this situation, there were a lot of eating disorders. Nobody treated eating disorders in those days. Eating disorders are actually very similar to drug use. They're both binge disorders. You can starve. Starving's actually a binge on starving. But in any event, there weren't good treatments for eating disorders. There was a 10 to 15% mortality. I evaluated over 40 years, probably 1,000. And what I had to do to treat those kids, because nobody else wanted to treat them. Insurance wouldn't pay. Nobody wanted to treat this lethal disorder where people are voluntarily starving themselves. They would do that in high school, then they go to college and get into binging, and then they get into drugs and alcohol and that whole thing. I mean, it was kind of a continuum of experience. I had to get incredibly tough. You couldn't get mean. You had to be that good cop, bad cop in the same person. I had to be really tough. I would refuse to treat people unless they committed to the whole program. The whole program meaning the parents had to be in treatment. The kid had to be in treatment. The family and the kid had to work with the dietitian. They had to see a medical provider every week. We paid for all of that in the private sector, and of course we couldn't make any money, and after 20 years I switched around, but I'm slow to learn or to give up. So basically, these folks can't set the boundaries they need to get well. It's kind of like we give out the drugs, and that's like telling a diabetic that's in a diabetic ketoacidosis, you know, that's got a messed up pH and that's on the verge of death, that they need to go home and take their diabetes meds. You know, it was kind of like one of my patients I received from a psychiatrist she was starving herself to death. And she was given 40 electric shock therapies at Sacred Heart Hospital. Of course, and she was discharged for not eating. Well, that didn't help her eat. Anyhow, moving ahead. Families of victims want help with structure from the treatment community. Decision makers and legislatures need help to get their laws set for supporting treatment system. Law enforcement needs a consistent model for decision making and the resources to execute those structures and laws. And policymakers need a rational, apolitical model. That's probably not possible. Medical clinicians want an ethical coherence. Therapists, this is a big deal. Therapists need clients to have reduced numbing from meds and substances if you're going to uncover the triggers and traumas. If people keep numbing themselves, we're never going to get to the root of it. We're not being compassionate, saying, oh, your treatment is voluntary. You can see the therapist if you want to or when you want to. That doesn't work, okay? It doesn't work with anorexia. You have to do the whole package to get these folks well. These folks deserve treatment, but the way we're going about it is we're using a messed up definition of compassion. We need to be tougher all the way down the line. I don't mean punitive. I mean tougher about them having to be in structured treatment systems. And we have integrated programs that work. I've personally been to Crossroads and talked to someone, actually, she was in treatment once and said, I'm not going back, but now she works there. She says, I'm gonna stay well. She's not gonna repeat. I know Veterans Village and Youth Connection is also another one that I need to visit. So we need boundaries anchored in the controlled burn model, predictable, supervised, governed, and safer. So let's look at that model.
But I don't wanna rush you too much, but
And we,
Okay.
we are over.
Okay, so we'll just do this section here. So here's the controlled. Fire starts unpredictably, it spreads rapidly without control, and it consumes the resources. We know that's happening. It's constant emergency response, and there's no plan for extinguishing. The prescribed burn, the fire is ignited under controlled conditions. Boundaries prevent the spread to housing and structure. Partial treatment isn't optional. Partial treatment, you don't get meds without structure. Multiple scheduled crews and clinicians can coordinate fire suppression or treatment. So basically what we're saying is that we need to have a structured situation. You know, hospitals have a structured situation. They treat really contagious diseases by physically containing that disease, by having boundaries and protective layers. So basically, let's come back down to the conclusion. If Mason County is going to ignite the fire and permit medications for SUD treatment, then Mason needs to support and participate in the treatment systems and boundaries that are necessary for the best outcomes. What's that mean for Mason County? We have a couple decisions. Either work to fully fund a structured, multidisciplinary treatment system that operates similar to a comprehensive, multidisciplinary, prescribed burn model. That may be beyond the budget resources of a small county. That may be there. Or we need to facilitate the transport of persons with SUD to systems that provide structured multidisciplinary care. Handing out drugs is a partial solution that is not compassionate, is not making people better. Allowing homeless encampments with known public health risks and public drug using behaviors to continue. It's not been shown to be effective anywhere. It's not compassionate care, contrary to what Seattle thinks. It's not compassionate for the substance user or for the affected community. Thank you.
okay, good. All right. So when it comes right down to it, we believe the ETSRB is proving to be the Pied Piper. It's bringing people in, and it's increased our homeless population in Shelton, Mason County, unacceptable manageable levels. The lack, where there's a huge lack of acting on existing laws that's led to the increase in crime and negative impact to our community. And we're saying no more. You know, we got to do. And what's the solution? Okay. We asked to move the ETS out of Mason County because it's drawing in so many people. I think we have a bus system that can transport them to the Olympia site. Let them go there. We did that just a little while ago because the ETS van broke down. And we could continue to do that. I think that would lessen some of the problems. So what can we do or what can you do, or the people that are watching this on TV, get a hold of our county commissioners and our city council people and tell them, you know, we need some changes to happen. Why are we not existing or not enforcing our existing laws? The conditional use permit on shelter works is some in question there. Community Lifeline being $400,000 in back debt, how does that get paid back? We can ask those kind of questions. And then this is just pictures of our city council members. If you have more questions and you want to contact any one of us, these are our names here. That's my email address, and you can go through me and we can, we ask that if there's people out there that want to see this presentation to their service groups, we'd be more than happy and present anywhere that people want to hear it.
Thank you.
Thank you, guys.
Yeah, thank you. Do you guys have any questions?
So many.
So many, yeah.
Right, you don't have time.
Yeah.
Yeah.
I know we try to go fast, but man, it's hard.
That's a lot to cover.
I'll just have you, first of all, thank you, because we already agree on a lot of this stuff, but I want to throw out there, though, some of the things that I don't think we can do much with, because I'm very transparent with you whenever I move with you, but I think what you guys are doing is right, and I do believe that there are things that can be done, and if we do nothing, nothing will change. I've said that to you guys before when we talked about it. I want to talk about the cart, the trailer, and remind you that even a county, we couldn't restrict a legal business to be able to come in. What we can do is zone and create a zone where it's a specific thing. We had the same thing happen here 20 years ago when it came to topless coffee shops, if you remember. We're allowed to zone certain things. So within the city, they are also allowed to zone where it can be, but that's up to the city. We have no authority over the city whatsoever. We try to work with them. I did have a conversation with, at the time, was the mayor, and we have a little disagreement on one part on, he thinks licensing is not something, they don't have an option. I've been doing more research, I believe they do. They do leave it to the state at this point, but they can also restrict through licensing and how much they charge for licensing. This is the idea that I've put forward, but it's not my call, it's up to them. And what makes the difference whether I'm right or they're right is whatever they vote. So it's that simple. I'm wrong if they vote differently and decide not to do it, so I want to put that out there. But as for that machine, when it first all started, the idea of it being doctor assisted with any of this made sense. When it's not doctor assisted, it literally is a food dish that brings in more and more that want to eat out of the food dish, and there's no way to deny that. And I don't think it's compassionate just putting out throwing more food on the ground. I think it's compassionate to put food on the shelf, have them work and climb up to get it, so they actually learn how to do it. Same thing with some of these treatments as well. I want to let you know I do always think that there are things that can be done. I brought this up before in the past, and as time goes on, we go through some political stuff, I'll be bringing it up again. I do know that there are ways that we can accentuate the stuff that we already have. We can increase litter loss. We can. It's within the purview of a county to do this and how we treat it. We can do it also with fire loss and a few of these others like this. And eventually, as a commission, I'm sure we will have those discussions. I'd like to get the information on your Onyx app. I know you guys have done it, but I actually don't have that. I would like to be able to see
You
that.
guys do have it, I presented it to you.
Yeah, I mean, if you could just send me the link, it's all I'm asking for, so I could just get on my phone and do it, I'd appreciate it. Other than that, again, I just wanna thank you guys for coming in. I do appreciate all the work you've done and all the effort. I do believe it is an out of control fire, and unless we put parameters around it, we're never gonna get control of it. We have to.
And we're not opposed to a hand up. A continual handout doesn't do anybody any good. Thank you.
No, thank you for coming
Yeah,
in.
we also did have asked to present to the city council, so we haven't got permission to go there yet.
Again, not our call.
No, I know that, I've been talking with Dave about doing other exchanges also, so if there's a sleeping bag, another one gets,
Yeah.
you donate one, another one gets turned in. The needle exchange has to be one for one. And I think that when we started the needle program, which was way before I think any of us here, it was, you give a needle, you take a needle. And that's the way that it was designed, and I think that if those that agreed to those terms back then knew that it wasn't being handled that way, it would be rejected. And I feel the same way. So I know that there's things going on that we're hoping will, even just a little bit, would make a difference. And so your presentation was perfect. I worked with the sheriff up there before and with you too. And the water quality, I really think that if we work on that one, that could be a big step in the right direction too. So, yeah, appreciate you presenting.
Yeah.
Thank you.
Thank you.
And thanks for asking.
So I'd like to try and get you guys hooked up so we can meet with the staff of housing and behavioral health, because they're the ones who really have to tackle this problem, especially what you're talking about, Dr. Sales. That's where it comes in. I see this needle exchange program is a total failure, and we hand out sharps containers. That is the dumbest thing you could ever do. If you have it in you to inject an opioid into your veins, I don't think you have the ability to decide to put it in a sharps container afterwards. I think you've lost that ability to make that decision. So we're trying to impose our rationale on somebody who is doing something that's completely irrational.
Right.
And I think we gotta find a different way to do this, because we're just giving them needles, whether they bring them back, or the same thing, needle exchange. They're not gonna bring back a needle. It does, it's,
I have a hard time wondering why do we give out needles in the first place?
but they're not acting rationally, just
Right.
injecting themselves with a drug that's gonna kill them.
Before all this, I didn't even know what a shark was. I really didn't.
And,
I'm only learning.
We need to move
the
forward.
terminology.
I appreciate all you guys are
Thank you
doing.
very much.
Thank you for
Thank you.
coming.
Yeah.
Thank you.
Thank you. Good to see you again, Doctor.
That's going on.
It's hard to do medicine in 6 minutes.
Yeah.
Thank you, guys.
Sorry to cut you off.
Oh, no, you have to
Okay,
do
so
that.
we have this TV.
Yeah, I'll get in touch with you. I think it's time to have this with our staff that's tasked with
You
solving
bet.
this problem. With that, we'll move on to our interview with the area agent. Glasses. Jennifer.
Hello, Ken. Good to see you. Hi. How are you? Good.
So the way this will proceed, we'll ask a series of questions and you just circle around through them. and
Okay, sounds good.
There's no right or wrong answer, it's just whatever.
Oh, are you sure?
I am absolutely certain.
Excuse my, I'm kind of losing my voice a little bit, so I'll do my best to
No, it's
answer
not
your
acceptable.
questions. Yes, I understand. I'll do my best.
That's fine. Commissioner Medlin, if you want to start. Sure. Circle around.
So what do you see is the function of the Lewis Mason Thurston Area Agency on Aging Advisory Board?
Well,
That's our
it's-
longest one.
Yes, it's a mouthful. So, really, in my perspective, it's a way for me to give back to the community. You may recall, I attempted to apply for a job with Mason County to try to give back, and I personally just have been looking for opportunities to either come and work in the community or volunteer. And so with this particular role, I see it as a nexus. I'm looking to transition at the state level out of human services, and this is a way for me to continue to stay connected to human services work in my professional setting. I'm looking to branch out and go back into the legal profession and mostly elder law and estate planning and that sort of thing. And so, as well as just connecting to that prior conversation was really engaging, and just kind of the intersection and the difficulties going on in Mason County around aging and the population, and some of the really high acuity needs of this particular county. So it's just for me looking to give back and to advocate for those in the aging disability sector.
Excellent, thank you.
So you basically answered the second question,
Oh,
which is
okay.
why do you want to sit on the advisory board?
Yeah, so again, just a way to give back as well as just stay connected to human services related work. As I'm transitioning through my state service career, I'm gonna be moving a little bit further away from the day-to-day of that work, but getting involved in a committee like this would be able to stay connected as well as stay connected, I think, in an area that could really use someone like my support, so.
Great. So the council meets the first Wednesday of every month at the AAA office. It's also virtual, so you can join that way, but it's between 9:30 and 12. Will that be an issue?
No.
Do you have any conflicts of interest with the mission of the advisory board?
At this point, as with any state role, I always have to go through a process in order for them to approve or disapprove. But given the scope of the role and functions in which I currently serve or which I am planning on serving next month, I don't foresee any issues of conflict of interest with this particular role.
And now the real challenging question, do you have any questions for us?
No, well, yes. What would y'all be looking for in a position like this from someone like myself? I know Sharon is the
Can I
board.
jump on
Yes,
that one?
of course.
It's all her.
Other than a warm body.
Oh, okay.
No, we're looking for somebody that wants to help with our seniors.
Yeah.
And I know that you've done that and I appreciate everything that you've done. But it's mainly just, how can we help our seniors with their needs?
Okay.
And there's quite a few out there, so, right now we have the advisory board that we have. Mason County has, quite a few vacancies.
Okay.
Man, it is an amazing advisory council. They are just all about housing and medical and providing tablets during COVID so that people would have interactions and things like that. And so the advisory committee or council, they are so necessary to the COG, which is the Council of Governments.
Okay, wonderful. No, that sounds great. All right.
So my answer is to help us advise, or to advise us on, situations, things we need to handle.
Okay.
We have quite a wide range of things we try and cover, so we need the advice of people who understand the subject matter and can act as our expertise in those areas.
Yes.
Wonderful answer.
Yeah.
Same thing. All right. Well, I don't have any other questions. Thank you so much for your
Okay.
time.
Thank
Absolutely.
you.
And then we'll let you know,
All right.
as soon as possible.
Okay, sounds good. Thank you.
Thank you.
Mark?
Morning.
Good morning. Oh, I had a question for this one.
Pleasure. Mark,
Mark.
pleasure. Hi there.
Good morning, how are you?
Good, Mark.
Good.
Morning.
That's because the first time we did this one, we asked a bunch of questions that didn't pertain to what we were doing.
Yeah, now they're better.
Yeah.
All right, we'll start off again. We'll just run through these series of questions we have and we'll get you take turns.
There you go. So again, thank you for coming. Now, what do you understand to be the primary role and responsibility of the Mason County Board of Health?
Well, I think what I see as a real opportunity for this particular role is for someone to create this, close this gap between public health and industry, if you will. My background is I worked for about 25 years in highly regulated industry healthcare, and I've spent about the last 5 years working in aquaculture. I see very similar areas of opportunities in both that I think I could articulate on both ends to bring people together to accomplish goals. And even from the earlier conversation, I see how many interconnections there are. Homeless to aquaculture, healthcare to aquaculture, and so on and so forth. And I think my career has put me in a position to be here today.
So what motivates you to serve on the Board of Health? And what perspectives, you kind of answered this one, or experiences do you bring to the roles?
Well, first and foremost, I love Mason County. I'm lucky, about 5 years ago, I've come here full-time, but I've been coming here since the early 70s. And at this point in my life, I'm very altruistic, but I want to give back to the community. And my experience in particular with aquaculture is a huge part of what Mason County is all about. But the sophistication level in that industry could be a little bit better. And I think that's one of the things that I could bring to this position, is be able to deliver, execute, and push through the goals of public health, as well as have a conduit of feedback back. And at least from an outward perspective looking in, I think that is an area of opportunity.
All right, so please describe your background in public health, healthcare, environmental health regulations, or your experience as a consumer of public health services.
Yes, well, all of the above. We'll just break it down. Again, I mentioned from the standpoint of there is in the world today, it's very difficult to find something that sits on an island. So all these elements are connected, and through my experience, I've touched all these elements. I worked in public health in immunology. So I had that experience as well as appreciation for all the works that they do, as well as the challenges of articulating that out to the community to drive results. And so I've experienced that aspect of coalition building, and that's what I think is really important, is to develop coalitions to achieve lofty goals. I hope that answered your question.
In your view, what are the most pressing public health challenges facing Mason County now and over the next 3 years?
Definitely homelessness. And again, that affects all aspects. You know, it affects with the runoff into Oakland Bay. So I think that's a big issue and how interconnected that is. To the degree that I would be able to help in that role, I'm willing to roll up my sleeves and do that. But I think that's the biggest issue that I see.
It's probably the easiest question on the Board of Health meets monthly, typically on the fourth Tuesday at 11 a.m. Are you able to commit to this meeting schedule?
Absolutely.
All right, do you have any current or potential conflicts of interest, personal, professional, or financial, that could affect your ability to serve impartially on the Board of Health? If so, please describe.
I do not, and if that would become a case, I'd certainly make that well known.
Are you affiliated with any organizations, agencies, or businesses that may intersect with public health policy or funding decisions in Mason County?
No, not at this moment.
Do you have any past or current public health code violations?
I do not.
All right, there's one that's more than a one answer. Have you engaged, or how have you engaged with your community on public health or related issues in the past? Please provide an example if you have any.
Well, I think I've become a real zealot of advocating the importance of aquaculture, in particular to Mason County, let alone the state. So obviously clean water is important to all of us, but I'll be really selfish, it's really important to Mason County. And so I've been a real steward of really articulating how important the little things that we do individually and then as a larger community that we do impacts the resource that we have here in water. So that answers your question.
Now, how would you ensure that the voices of underserved or marginalized populations are heard and considered in the Board of Health decisions?
Well, I think that goes along with developing a coalition. So hopefully with the coalition that you've created, that you would take all those various groups' needs, concerns, and problems together and you would overcome it that way. That's coalition building.
What strategies would you use to communicate public health information to the broader community and gather feedback from residents?
Well, in the world that we live in today, there's no one medium that you can use consistently to reach individuals. So it'd be a barrage. I have a marketing background, so from social to mail if needed to all the other aspects in traditional marketing. So I believe that you have to use all those elements to really maximize your ability to reach your audience with the message that you're trying to do.
And I'll throw one more question in there we always tend to ask. Do you have any questions for us?
I certainly do. What do you think the biggest challenges are for this position in 2026?
Do you want me to jump?
Go ahead.
Okay, I'll jump on that one. I would say, other than water quality, I mean, I think it's a compounding. So you've got your water quality, you're also, my speaking abilities, your, the homelessness, drug abuse. We've got drugs that are not even regulated that are out there for the public to use. So I think that it's all inclusive, and if we just concentrate on one, something is gonna slip through the cracks, but it's also very hard to concentrate on everything. So and I think that that's why we have a Board of Health, so that we can look at the different issues and concentrate on what we're proficient at.
I heard from you that you know how important this position is, and I feel that way as well, especially where we're at, you know, and it goes back to all that interconnection, homelessness, drug, you know, aquaculture, and so you need someone that can manage those different groups, and I'm your person.
You know, what's funny is I think you came at an interesting day. Because of
I
the stuff
did.
that
It
we're
really is.
dealing with,
Right.
and also that's the chair over there, that gentleman's the chair of our Board of Health. And Commissioner is correct, we are moving in the direction of looking at some of the stuff that's kind of been on the outskirts for a while about these unregulated drugs. I'm not, just call it what it is, because it is drugs, and it's having an effect. That's coming into play right now. But it's really interesting because outside of a pandemic time, we do focus an awful lot on water and water quality, and having somebody that brings more of that, we rely on the man behind you back there for all and every aspect of that, because in the last few years, we've created clean water district, we've done a lot of different stuff to do with that. So it'd be nice to have, somebody from our board bring in some of that. I enjoyed that.
Yeah, I would answer your question. It's really having a more holistic view of it, as public health is not just one segment of it. It's looking at the whole thing, because the problem has gotten so large that it's affecting business and industry and the health of the citizens, you know, the needle problem and all the issues we're going through. So, you know, we had a presentation a few weeks ago about the size of aquaculture in Mason County and the importance of it.
And will only continue to grow. We need to have a big piece of that pie.
Yeah, and I want it to grow. I want more shellfish.
Yeah.
The way we do that is clean water. So, but it's, again, holistic, a picture of.
And good balance
Yeah,
with all the constituents.
yeah. So that's my answer to your question.
Very well. I agree with all the good questions. We'll be in good alignment, accomplish what we need to do. So that's it for me. If there's anything more I can do, I'd be
We
happy to
will,
do.
we'll discuss it and get back to you. Should be pretty quickly.
Thank you. Thank you all.
Thank you.
Nice to meet you.
Thank you.
Pleasure to meet you. All right. Sheriff Spurling.
Good to see you.
Feel like we're drinking out of a fire hose today.
You guys are getting lots of stuff.
I would try.
How are you?
Good.
Long time no see.
Get in a position to kick me if I say something wrong.
Been a while since we've got to do one of these. I think it's been since October, was our last one, when we came in and just did a general briefing as to where we've been and where we're going and
Maybe it was
stuff.
November. Year seems to be
Other than budget?
blurring by.
Yeah.
We just, again, this is an opportunity for us just to share with you guys what's going on, so that when we're looking into the future, when we're doing things, you know what the status is. You guys being elected officials, just like I am, you get asked by your constituents, what's going on with this, what's going on with that, so we feel that it's a benefit for us to share this information. And honestly, a lot of it came from Travis saying, hey, a lot of other people really don't know what's going on in the sheriff's office, and we've never been all that great in law enforcement advertising what we're doing. We just do it. So this is a good opportunity. We want to continue with it as much as possible. Just an overview for 2025. This last year we had 22,566 calls for service, which is, you can see, it's down 6%. Decrease from, now, Jason, what was, the year before we were at 24,016. Now, that could be because we have the online reporting. And the online reporting has reduced our numbers. There are two different pockets, so we gotta take a look at that. But other than that, some of it is educating the community on what to call 911 for, or other things like that. We had 152 burglaries, which is considerably down. I can still remember just the north end in 2014 had 254 burglaries, and that was just one part of the county when I was in the chief up in the north end. So 152 is down from what we've had in the past. We had 272 assaults, 615 traffic accidents that we covered, not including obviously state routes that the State Patrol covered, 272 DUIs, 354 thefts, 529 warrants, jail bookings, 1,465. The previous year was 1,111, so we've had more jail bookings, and that had a little bit to do with our staffing and our capacity in the jail. Litter crew, our litter crew picked up 165,765 pounds of garbage along county roads, which the year before we picked up 173,000. So similar. Our public disclosure requests, 1,848 public disclosure requests. We're still running at 75% of the county's total PDRs comes through us. We've been as high in the past as close to 80. And our civils served,
This number, 2,227, is the actual served, but if you count our attempts, we were at 3,761 because there's 1,500 attempts that we try to serve somebody and they're not there, we can't serve them. And you can see on the sheet that Jason gave you, our DUI arrests are up 23%. Our assault-related offenses were up 3%. Burglaries down 18.3%. Theft-related crimes 33.1%. Traffic accidents 26%. And warrant arrests up 5.8%. Some of the things, first off, I wanted to thank you guys as a commission for your support. We're back up to staffing levels of 2018. We lost those 16 positions back then, and we're back up to it, which has allowed us to take 5 now on our set team. A sergeant and 4, I think we're in. Sergeant and 4, and if you've watched our social media, our set team has just been doing some really significant work, making critical arrests that clear up problems in a community in a big way. And they've been doing great work. Really excited about what they're doing. And it has a lot to do with you guys supporting us. Also, we're excited to have the strongest DARE program that we've had in many, many years this year. And part of that recovery money is allowing us to do that. And I know you guys had to deal with the traffic diversion, with some of the things, and we're going to be able to justify that. Undersheriff has put a lot of things in place, and we just met, the undersheriff and the chief just met with Loretta and Mike, and I'm not sure who else was on that one because I missed that one.
Several people, but we're on track.
Yeah, we're going to be able to, we're not worried about a state audit. We had one back in 2021 or 22, and we had no problem with justifying everything. We were above, so we should be fine there. We're going to have a staff retreat coming up on Wednesday, and we're going to be reestablishing our goals for this year. We take a look at our strategic goals for 5 years, and then we look at our strategic goals for 1 year as well. I think we almost hit everything on our goals for last year. We're still working on a few things. Obviously, we've been, Commissioner Tarswell and myself have gone and visited a couple different properties, problem properties, and we're trying to figure out how we move forward as a community. These have been long-standing problem properties throughout our community, and hopefully we're going to continue working on that. Our staffing levels, our patrol, we're only down 1 position on patrol, which is really good, and our jail is down 5 positions right now, which we were down 9 before. And we graduated 3 from the academy just last month, which was a big deal, and we have a lot of people in FTO, a lot of young people. Again, you get somebody that's retired and they come back to the office and they're like, I don't even know anybody, because there's so many new people within the agency, and we've got great people. Excited about that. I am not asking to be reappointed on the MTA board. I know all 3 of you serve on that, but when I surveyed what I'm doing, I'm on over 10 boards. I know that's nothing for you guys. You guys are like on 20 or 30 boards, but for me, still being able to be out in the community and do the work that we do, I'm gonna have to cut some of those back. We're hoping, and I think, Jen, you're gonna brief on the co-responders. Did you wanna jump in and do that now? Sure. Is that?
It's later.
That's later?
The chair.
Okay, well, we can do it later. I'm gonna mention that we got the 2 additional co-responders coming on, which is going to expand our ability to, 7 days a week now?
I think so. I think
Yeah.
it's 7 days a week and more hours.
And that has been a great program. Thank you for supporting that. There's sometimes when our deputies don't even get seen by the individual, they'll hang back because a uniform may aggravate the situation, and then there's other times when they're going with us or they're hanging back until the scene is safe. But it's been a really important piece. And one thing I would encourage you guys to do as well is to continue to move forward on the animal control. I get hit at every community meeting on animal control, and they're asking, what's going on with it? We heard that it was gonna happen, and so they're asking in the community on that one. Did you have anything else, Jason?
We can't get a contract from JAS. It's in their, the ball's in their court.
Okay, well, in that, I'll let the community know when they're asking me that. We're still waiting for them to give us back a response.
Yeah, they're very, very slow in getting back to us.
I don't have the numbers from this last year yet on the total number of animal controls, but the year before we'd had 1,200 for the county, and I think we covered 900 animal control calls, which is, it's a significant number. Do you guys have any questions for us?
You just had an incident, and I know we try to always keep in front of things. I know we wanted to have carts in the jails and stuff to make sure you can block the doors. We talked about that in the past. I understand with this incident, that wouldn't have even helped anyway because a segregated area. But I'd like for you to consider what it would take to create a little bit more of a buffer for safety there and what tools you want from us to make that happen.
Okay, and our jail chief is here. He let us know right away, and myself and the undersheriff, and I think even Chief Rhodes went over to the jail right after that happened and talked to both of our deputies. The one who was punched and the other one who kind of got forearmed.
And we understand things are gonna happen, but if there are tools that will make that happen, we won't know unless you tell us. So please, we'll keep them all safe if we can.
Okay, thank you.
So I see the traffic accidents up 26.3% and DUIs up 23.6. So correlation, is that
Oftentimes.
the more we have drunk drivers, the more accidents?
And it's, you know, they're looking at legislation for a .05, which would probably right up front really increase the number of DUIs as well, because that's a significant difference. A lot of people think .8, .5 is not that big a difference, but it actually is. Well, we used to have DWI and it was a 1.0, and that was back in the 90s, and then they went to the DUI, and that was a significant increase as well. And with the amount of marijuana DUIs that we have and other prescription drug DUIs that we have, this isn't just alcohol related, obviously.
No, but it does add to the number of accidents.
Yes.
I don't thank you for testifying and being up on the hill, because there's some pretty nasty stuff out there, especially affecting you guys. And so, if you need help doing any of that, please reach out, and I'll give you any assistance I can.
I think I was in Olympia 4 times in a 7-day period, and I was like, I don't want to go back. That is a busy place on a short session.
It is, yeah.
Very busy place.
Gonna
It's
get
busy on
busier.
a long session.
Is it really? Well, see, I'm not very tenured in that area, and I know you guys are.
Yeah, but if you do need anything, just reach out.
Thank you.
Thank you.
Thank you, guys.
Is this helpful?
Thank you guys.
Is this helpful to you guys? I know we stay in communication
Yeah.
quite
There
regularly.
was a time in the past, before we had administrators, that all the electeds were in front of us all the time, because that's where we were here, what was happening. So I always like face-to-face, so please, come anytime you want.
Got it, thank you.
Or anytime he forces you.
Yeah.
And thank you guys.
Thank you. Kell, you're up.
Morning.
Good morning.
Hello, sunshine.
Hello. I'm just here to set a public hearing for March 17th for a requested rezone in the Shelton UGA off of Johns Prairie Road. The Planning Commission heard and unanimously recommended approval, and staff is also recommending approval. But this is just to set the public hearing.
This is going from commercial to residential?
Yes. Yep. So,
So we need to find
So
some commercial.
I would action agenda for, I think February 17th.
Yes.
Action agenda on the 17th, and then public hearing on March 17th, yeah.
St. Patrick's Day.
Yeah. Okay,
Yes, ma'am.
that's it. Easy.
That was it? That was easy.
That's it, I know.
Yeah. What, can you bring us numbers one of these days too?
Sure, yeah,
Permits
absolutely.
and stuff.
Absolutely.
Is this you guys? Dean?
All right, public health.
Morning.
Morning. Yeah.
So did you try to buy Amazon?
I forgot what it was. I didn't, but I'm still plugged.
I actually went and looked it up this morning and placed an order. So, yeah.
I'm gonna have to.
Okay, so
Helps me.
Yeah. So, yeah, we're gonna start off with Melissa, and then I think that's where we are in the order. But start off with Melissa on the 5-year plan. So a little bit of background. After we were here last time, I went through and I pulled the 5-year plan down to like 10 pages, and then went back through the commerce checklist and added back the things that were required,
Yep.
and it ballooned back up. But not to the point that it was before. So we've restructured it, and then we took the section that was the actionable piece and made that the plan, and then everything else is a reference. So,
I'm a fan of putting things in the appendix this way, it's not, if there's any confusion.
right.
And again, we're still at the same action point where there's only 2 actions, there's no other actions.
Right, it's just 2 actions, yep.
Which is the creation of those little sub-bodies or something.
Right. So it really comes down to the formation of the
Committee.
provider committee
Committee.
and then the advisory committee.
Mm-hmm.
So, 2 things.
And so we have to continue the public hearing. So if, I think the formal request is to set the public hearing for March 3rd, so I'll have to move to the February 17th action agenda. And I've already attached a notice of public hearing. I also attached the plan guidance as well as the checklist that Dave mentioned, just to show that we have fulfilled all of the requirements according to Commerce, with the exception of adopting it.
I will not be here on March 3rd.
Oh.
Do you wanna postpone it then?
Yep.
Probably,
Okay.
We did get an
I-
extension.
As a rule, we try to always back up the commission if they feel it's important and they want to be there for it. It's not even a question with this normally, so apparently it's
When's
not
the
now,
next
so
one?
yes, we need to make sure that he's here for that.
Is it gonna be March 17th?
March
then?
17th.
Okay.
Yeah.
We did get an extension through the end of March from Commerce, so that should still be,
But you can still put it on the agenda this week to get.
Right, on March 17th.
Just when you're scheduled.
And Commerce FTA has been really amenable to working with this on.
Tell they read what you pull out.
Yep. Well, I think they're gonna be okay with it.
we
Yeah.
still fulfilled all the requirements.
Yeah, so we went through their checklist, we're down to 3 boxes to check, I think, as the last thing. So, 2 boxes, okay, so we're getting close,
It'll be fun.
yeah. Okay,
Any questions about that?
okay, so,
That's all I had.
next, Ian and I have been working together based on conversations we've had with the commission the last couple of weeks. And Ian, you want to go ahead and take this? I don't have my page in front of me.
Yeah, so, we've recognized that code enforcement is a major issue in the county, as evidenced by many of the discussions that happened today and in many previous, meetings as well. It's an issue that a lot of pressure and focus gets put on public health, but it is a comprehensive issue that impacts many different departments and agencies. So our proposal is to have a group that meets and coordinates enforcement action for code enforcement properties, and we could establish something like we have to look at our resources, we have to evaluate our resources, but either picking 5 or 10, depending on what our resources are, and then having all of the involved parties take, lockstep code enforcement actions to get the problem solved on that property. Because there are times where we will, like for instance, public health will need vehicles removed, but the sheriff's department will have trouble getting those vehicles declared as junk or hulk, and then they can't get removed. So our timelines then are held up, and we have to give people a lot of extra time. So if we could coordinate activities like that, there are also times where there are many RVs on a property, and we're saying you got to get rid of this junk, and there's lots of RVs on the property. If we're saying all these things that are violations or have the same timelines, and we are all staying in lockstep on that, that may create pressure that will help resolve those issues more quickly. Maybe that's, kind of the idea that we're going with at the time, but.
Right, and we're doing some research along the lines of, through MRSC, and then I went through RCWs, and some of them I went back as far as like the early 90s to find RCWs that are applicable, that just kind of sat on the shelf and I sent those to you earlier. I think some of those things, they're not a silver bullet, but I think that's another tool in the toolbox.
I think the main thing I want to emphasize here is that with the biggest difference when I look at our county and other counties is that they have this backstop of either abatement or taking the property. And that's kind of like, you know, we have a whole cascade of enforcement actions that we take, from letters, notices of violation, infractions. Eventually there comes this time where we do all of those things and they're not effective for various reasons. Sometimes, you know, right now we have several properties where the owner is deceased and there's no one that's legally responsible for the property. And those are situations where infractions are not helpful. We don't know who the people are that are on the property. We can't identify them, so we can't hold them responsible. The owner's dead, so we can't hold them responsible. How do we make change happen on that property other than the county taking that property over to force change to happen? That's the only path that I see, and unfortunately that takes a process and funding to do that. There is a method that I can take that is kind of like buying things on credit, where we start that process, but eventually there's going to be a cost to it. So we can levy what are called civil fines on a property without going to the hearing examiner, without any court action, and those can be liened on the property and collected as property taxes and collected as delinquent property taxes. The problem with that is there's a timer ticking with that. All it takes is someone to appeal that, and then we have a hearing before the hearing examiner, and that's on average $3,000 for a hearing examiner hearing, which we don't have funding for. So if I start taking those actions, we could have kind of costs building up that are unrealized until they happen. Someone appeals it, there's $3,000 or more. So I have held off doing that because it's a cost that I'm kind of committing to maybe paying that cost and not having any money in the bank to pay with. But that can be a cheaper initial option.
We're gonna have to look at putting that in the budget, because it's something we're gonna have to start doing, figuring out the best way to go about it, but we've gotta do something. That may be something we gotta put into the budget next year, so it's.
Yeah, we talked about this last summer, about an abatement fund, and then how do you fund an abatement fund? So that's a question that would need to be answered. There's different ways of doing it. I came from Montana, where they had a, what do they call it? A decay ordinance. And a decay ordinance charged every parcel a certain amount. That went to then an abatement fund, then went to dealing with these properties, and you could broaden your definition beyond what a strict public health definition is, and you could take it as a blight nuisance. And that's the other rule I sent to you today, was about blight nuisance properties. And that is different from public health in that it becomes a councilmatic action, not a public health action. And I talked with Tim this morning, and he said that's we don't have to add it to the code. It's already an RCW, so we just need to reference the RCW and you can move forward with it. So it's something that we can look into and move forward with, right away. So we wouldn't have to have a delay on that. So getting back to the main question is putting this group together. Who do you want to see on it? And does that look like the right cross-section, and how often? I would say not less than monthly.
I think it is. It's something I've wanted for a while, but thank you, Commissioner, because you're the one that put this together and put it forward. This is what's gonna make the difference. We'll get one off after another, but you have to do this in order for that to happen, so thank you for that. Abatement fund and pay for, I'll throw some of the ideas out there. We have an abatement fund. Can we find out what type of nexus we can use to try and use from the building department on over? But then again, we still need to fund things.
Yeah.
It doesn't so the building abatement fund is
Yeah.
separate and cannot be used for It can be used for the building department enforcement actions, which.
But we're gonna be doing building department enforcement
Yeah,
actions
we-
as well. So that's why I say we need to
Right.
find out where those nexuses are, then we need to look at creating those funds, because it's a priority. What's a priority? Whatever we take in for dollars, we have to decide what's our priority. I think this is a very high priority, so we look at putting some of those monies aside. Then we also look at how to recoup some of those monies. It might be through tax, put it onto their tax. It may be from tax sale, or something at the end. I hate to say all that, but sometimes something has to be done with that. I don't know if we can ever do anything in the form of loan because we can't extend our credit, but we might be able to do some form of loan. We've done it in the past with other things. I just haven't seen it in the last 15 years since I've been here. The Board of Health thing that you mentioned also when we were in the room, that's what you're talking about with Tim. I'm so happy that that you felt the need to find them, because there are answers out there, we just gotta find them and keep going. So the beginning of what you found is gonna be our next steps in what we do, and if we run into a brick wall then, we find another one. And then they go away one at a time.
It's interesting things you find on the shelf.
So you asked the question, who should be involved in this? Well, I would guess that the building department, the sheriff's department.
Right. I like your
Possible.
proposals.
Yeah, I do too.
Yeah.
I like what you put together, I think it's,
So we can set it up and start pulling the partners together and then doing it up like a monthly. I think that would be a good place to start, at least in the beginning, at least monthly. My staff meets regularly with Kell's staff, and we cross-pollinate between the two departments, and that works well. This is a step that would go beyond that and reach into the city, into some other pieces, sheriff's office, because these things are not, they are all complex.
And it may not hurt to have the city involved. We're not going to be doing their enforcement or things like that, but the problem does exist in more than just Mason County, it's both.
Right.
city
Well,
and county.
if we have a Board of Health member on there, and if the Board of Health member is,
The chair.
Eric Niska, then that would
well, for the first year,
help,
Yeah.
that would help start that off at least initially.
Yeah. Yeah, I'm just trying to make sure that we keep the whole county in mind.
Right.
And remember, we can, I don't like adjusted budgets, but they can be adjusted mid-year, and we have things that come up each time. We might wanna consider putting a small amount, just not to use it, but as a backstop in case it has to be used. So it doesn't put a strain on your budget at that time. And it might be as simple as a $10,000 thing. Cause the idea is not to use it, but if it was there, we don't wanna crush your budget in the meantime. But that's something we would all discuss, and not ready to do that today, but just something to discuss.
Yeah. I absolutely love this. I think it's the right path forward. We've talked about it and talked about it and talked about it, and now let's put it in,
Yep.
enough talk, let's move into action. MRSC, I would encourage you guys to take a look at what they have on there. It's very, very informative. It gives good direction, has samples of other,
And I have reached out to them in the past, and they've just told me, don't do that, on a couple of things I was thinking about. So
Well,
it's,
no, typically they'll say,
Yeah.
consult with your attorney.
yes,
Because so
Yeah.
any legal
Right.
thing, we always have to consult
Yeah.
with our attorneys, because they will redirect that back to our attorneys.
yes. Yeah, I think that's how they put it. Something like, that's an idea, but I would talk to your attorney first.
Exactly.
You know, yeah,
Yeah,
so.
yeah.
Yeah.
But if we don't push the envelope, even on some of these things that are questionable, they already won. The whole idea is we find out whether they'll challenge it. If we're worried about them challenging it and we never do it, then that's better than them challenging it, because we
Right.
automatically lost.
Yeah, the people that you're suggesting beyond the coalition, I think is perfect, because it's every department that we need to use and that should be used, so I think it's awesome.
So there was, if I can jump away from this for just a second, there was a question on the applicant for the Board of Health position, and which category that the person would fill, and I went through the state rule. You know, we have been ahead of the state for 20 years on how we've organized our Board of Health. He would fit under the elected section, and they have 3 other subsections. He would fit under subsection 2, which would be business or other community partners. So,
Thanks for looking into that. I just to take a look at that to see where he would fit.
yeah.
We've
So,
been ahead for only 13 years.
what's that?
We've only been ahead for 13 years.
Yeah.
We created that because we only had the 3 commissioners sitting on there
Right.
voting, and none of us knew what the hell we were doing. We were brand new, and Tim wasn't here. It's like, that's the stupidest thing. Everybody's waiting for us to make a motion. What are you talking about? We don't
Yeah.
even know.
So when the law changed 3 years ago, it was very easy for us just to make the
Yeah.
minor tweaks and move forward.
Great.
Okay.
And the only other thing is, we're in the middle of funding discussions on the Hill. So
Who isn't?
Yeah, and exactly, who isn't? So Public Health has pared back the things we're working on this year to Kratom and a couple other things that are very obvious, and then other than that, we're just watching and listening on budgets to see which way things go. There will be cuts to public health across the system, and we're working on how to allocate those cuts across the different departments. You know, trying to maintain the smallest health jurisdictions whole, and then the rest of the system takes the cut. So that's where we're at now.
Fun times.
I thought you were gonna say there will be blood.
Yeah, oh, and it's getting feisty.
Yeah, I know.
Yep.
All right.
So I have something outside of the, we had conversations about it today, the needle exchange. When it first came up, it was a hard push because I was guessing, but I want to say when it first was introduced, it was actually very successful. North Mason, the reason why it was put forward is went out there in that little tiny park and we cleaned it up and took out hundreds of needles with the little kids. For the several years after that for cleanup, it was still effective because the needles were not coming back. But I do know that it was mandatory that it was one in, one out at that time. Now, it said today that we may not be doing that, and I wanna
I
find out.
want to be checking with, we had had this discussion. Right. And then I was, let Commissioner Trask know that on the sleeping bags and tents, that got cut off because they're, like, it was brought up, they were turning into solid waste.
Yeah, it is.
Yeah, people were not
I just saw
turning them in.
pictures of it, actually.
Yeah. So we cut that off, that's not being funded.
Okay, but the needle thing, please make sure, we wanna know if you could bring that back to
Right.
us, cause I wanna know 100%, cause if it's not 100% one for one going out, and the reason why they would change it in, one of the things we went off of is, they were stealing the sharps boxes, because it does have value.
Yeah.
You know, a new needle, so if it had value, that's one of the things we thought about, and they were bringing them in, exchanging them, but if they're not exchanging them, and we're just giving them out, then we are creating the
Yeah.
problem, not, so, please
But
bring that back to
if-
us with
If
an
it completely
update.
goes away, they're gonna go back to pulling sharps boxes off the walls at the hospital and anyplace else, they're sharps boxes.
Yeah, but they're gonna do something anyway, and I'd
Right.
rather that than we feed hundreds or thousands of needles on the ground
Yeah,
for
I
somebody
get
else to
it.
get cut with in a park.
Okay.
Or anywhere.
Yeah.
They're all over the county.
Yeah.
Thank you.
Okay.
Yeah, thanks for answering my question so quickly too.
Yeah. Yeah.
Typing over here.
Yeah, no problem, no problem.
Yeah, Sheriff and I went out to look at a problem area, and he pointed out a bus stop where they just pitching needles.
Yeah.
He pulled hundreds out of there, and the very next day, there was 3 right there, yes. You know, overnight.
Yeah, and that's interesting to me because the method of drug use is changing. Less injection and a lot more sniffing and other things, so,
Yeah, but then again, if it's so easy to get, they'll throw them away a lot more. You know, if, you know, the person that uses 4 times a day doesn't use the same needle over and over again, if they can just get them totally for nothing. Easy, without a trade in, a trade out, so
Right.
now you got 4 needles on the ground instead
Right.
of.
and you can always buy them too, you go into the Meals and buy them,
Yeah,
so,
they're
buy
cheap.
big bulk bags, so.
There's no easy fix. But
No, there's no easy fix on
But
it.
one
But we
bite
can-
at a time.
Yep. So, okay.
Thank you.
Thank you. You were up. Morning.
I have one discussion item and then a couple of other just updates. if you have time this morning. It's kind of a full house. So the first discussion item that I have is a letter to DOT about a second access for the development up in Belfair, the Gateway development. And we briefed, I think, some time ago on this. And Commissioner, you asked, what's the design
Yeah,
look
what's the
like? What are they
design?
talking about? Generally, where is it? And so that is attached. And just to let you know, Commissioners, this is something that is strictly in DOT's wheelhouse. So it's their permit process. Where our interest is in making sure that we've got adequate circulation, adequate emergency access as new developments come online. And I believe that that Randy Collins has already submitted a letter to DOT very similar to this. And so I just wanted to check in with you and let you know that plan to.
This is another right in, right out.
It could be, that's what they're demonstrating here, but of course it will depend on what DOT says. They'll take a look at things about distance from the roundabout, exactly.
I would say, if we haven't learned anything from the other stuff like by McDonald's, then we haven't learned anything at all. We have to be aware of what we're saying yes to and what we're not saying yes to. That's a 50-mile-per-hour zone right there close to that area. Right in, right out is the only way I could see it, because that is also where all the accidents are, when people decide they wanna, there's another term, U-turn. It's called flip or something, so I'm not gonna say that, but when they just do that on top of the hill. I've known of several people that have been hit just because somebody turns out there. I could not even stomach the idea of a left turn out of that. The dangers are just too high. I don't know why we'd be supporting
things that DOT
Yeah.
evaluates and approves.
Except for these people are passing each other, because it's at the end of that area, the sheriff is over there nodding. It's just such a dangerous area. Let me ask you, why is it necessary to be there instead of using the traffic circle? Can you help us understand that?
Sure, it has to do with our code, and probably Kell could speak more to that as far as what the requirements are for second accesses for subdivisions and.
But it's off this same
Fire
road.
department and all that.
That part I remember, because I was part of all that when we did all that, but that's off of the same road. That's kind of not a second access like when it was designed. That was supposed to be given different access coming out of the road, but using the same road and just having two things is a little different. Kell, would you mind sharing with us?
Yeah, I mean, our code does say that after 100 units, you have to have 2 ingress and egress from a subdivision for general circulation. Our fire marshal did look at this, and I don't have it in front of me. I know that the proposal for the ingress egress onto SR3 is a right in, right out. But there is a question about the double access outside of the subdivision too, because there's a.
This is off the same road.
A road in between the subdivision and Highway 3. But, yeah, I mean, Randy and I discussed it briefly this morning. He wasn't able to be here to share his additional concerns, but.
You wanna take a look at it and drive up there, commissioners, and take a peek at it yourselves?
I've been up there quite often, so.
Oh, I'm pretty familiar with that area.
Yeah, that's a one dangerous.
Yeah.
And again, this is a
Seems like
DOT
right
reviewed and
Right.
approved
Yeah.
access, so
I can support a letter
the letter
of
is
support
gonna.
for right in, right out only. I just can't bring myself to support a letter for left, and I'm not even sure it's needed. Now, how many units do they have there?
They have 99,
So
and
it-
then they are planning to submit another development here in a couple months, I believe. Yeah, so it'll trigger
And
it
we'll
at
trigger
that
at that
point.
time, so it's not for this development, it's for future development.
Very, right around the corner.
But yeah,
so.
I would be supportive, right in, right out only.
Which is what the letter says, and it also says that recognizing it's DOT's infrastructure, so they're the ones that are gonna say, yes, it meets our design standards or not.
But again,
Yeah.
That's not, that's just too easy, Loretta. We live by this, whatever happens. We don't just say it's them. That's why we're dealing with that at that intersection. We have to be forward on it with our strength behind right in, right out only. I don't wanna leave it to them. That's why we ended up with McDonald's and those accidents right there on that intersection. The people there are furious for all these years. Let's weigh in on it. That's what I'm asking. Don't just say it's theirs.
Well, I believe that that's what this letter is doing.
It's
We're-
exactly what this
We're
letter
weighing
says.
in, we're expressing our opinion.
Yep.
So, I support it. I think it's a good letter. Thank you.
Yeah, the only thing I would add in there would be, I don't know what you call it, but basically it's a forces you to be right in, right out.
That's what I'm saying.
You know, the cement block there that says you gotta go right. You can only get in it right, and you can only get, much like you have in front of Public Works. But that's part of the design.
Can you add that in, that request in
They're still gonna have to have a long lane to catch us
Sure,
too.
and it says that the access is depicted in this.
I know, that's what I'm saying, that's the weakest way to do it, Loretta, please add the actual words. At least it's
Will do.
important right in, right out.
Will do. All right, thank you, commissioners. A couple of other items that I just wanted to follow up on. Thank you, Commissioner Trask, for the presentation to the Legislative Steering Committee about the CRAB audit findings. I'm not sure, commissioners, if you're familiar with that, but basically, CRAB discovered that for the past 18 years, the motor vehicle fuel tax was not appropriately
Being
allocated.
distributed.
Yeah,
Distributed
the
to
distribution
ferries
wasn't
instead
correct.
of-
With everybody or us?
Statewide.
No, statewide.
So it was $110 million over 18 years statewide.
It's
And to
1.7
Mason County.
million, over 1.7 million to Mason County.
Absolutely. So as soon as that was discovered, they reallocated or ceased that and corrected it last year, but now there's a proposal to recoup those funds.
That's what I was gonna ask, what was the remedy?
Yeah, so there are a couple of alternatives that were discussed and presented at the Legislative Steering Committee, and we shall see how that plays out, but.
We wanted to make sure that our voice was heard before they, because right now they're working on the transportation budget, so we wanted to make sure that our voice was heard before they come to a final decision.
Yep. Yeah, so thank you for asking pros and cons on those two alternatives that were presented. I think it's just gonna be a matter of if any is appealing to the legislature, so. If we get anything, we'll be very happy, and as you know, Mike and team will put that money to work. The other that I wanted to let you know about is that they're wrapping up, speaking of Mike and team, the levee repair out in the Skoke Valley, so that should be done today. And then as Mike indicated last week, we'll come back to you to talk about future efforts in the valley there. And then we had a good meeting with the Victor Improvement Club to talk about the lease agreement for our Victor Pump Station in the North Bay facility. And we'll follow up on that. So they've got some ideas about some things, and we have some ideas, and we'll move forward. That expires here in March, and so we'll be briefing commissioners on the 23rd, and then have some type of action if we can't come to agreement, to at least extend or continue the terms until we hash through.
Okay.
But
Commissioner Netherland, you suggested purchase.
Sorry?
You suggested purchase of the property.
Of which one?
Out there on Victor?
Victor, yeah,
Oh,
and
the one on the thing, my apologies, I'm thinking of the accidents and the possibilities on the other. I'm really worried about creating a situation where I get somebody hurt But no, yes, I absolutely, it would only make sense, and we can only pay a certain amount anyway, by law, we can only have.
Yeah, so presently we pay nothing for that pump station. It was a kind of a mutual benefit thing. But they are interested in selling the property to us, and so those are all
We'll
things that
avoid
we'll
questions
need to
later and issues
weigh.
later.
Yeah,
And the price can't be that high, because where it is, what it is in the right of way, right off the right of way, basically.
Yep.
On a cliffside. So it isn't like they can build
waterfront
anything.
view.
Yeah.
It's a waterfront
They
view.
couldn't build anything there.
Yeah, so, anyway, that's going on. And then I wanted to let you know about, we have a new Public Works Citizen Request database or tracker, and this is kind of modernization of our existing. And I wanted to thank Ben and our admin staff for working on that and rolling that out, and really excited about it. It's got a dashboard, so you can kind of see by area, you know, where the request's coming in, what the length of time is to response, what are the types of requests, are we getting tons of mowing requests, are we getting sign requests, what is it that we're hearing from folks. So it's really much more user-friendly and informative to us to how we manage. And ultimately, it's just making sure that we have timely and good response to our citizens. And so I'm really happy about that and thankful for our admin and IT folks. So yay, if you ever want to see our fun little dashboard, let me know. It's pretty awesome. And I think other than that, just, you know, like everyone else, tracking bills and potential impacts. One other that I wanted to point out is the solid waste collection tax. There's a proposal to increase that, and those funds go to our solid waste management plan, basically. But what that would do is increase the collection tax from by 2.5% over a period of 5 years. So that, of course, is passed on to.
Right, I don't believe that one is councilmatic. I think it was just, it's the legislature telling us to do it.
Yes, exactly. So we'll keep an eye on that. And of course, there's always the host of other solid waste bills on recycling and so on. And on the public works side, procurement changes, so increases in procurement
I believe
authorities.
That one was moving along quickly.
It is.
And that's one that we do support.
Yep. Yep. Senator McEwen had a bill, or has a bill, that directs DOT to be more proactive on our fish barrier projects, so that they are using funds from the project potentially to help with utility relocations. And as you recall, I think we spent just under $250,000 for the Victor fish passage project, so that's helpful. And at a minimum, making sure that DOT is more proactive in notifying utilities about advanced projects, so we've got adequate time to plan and budget and prepare for relocation. And this is something that our PODs have been very, very aggressive about, probably the last 2 sessions. So very impactful, not only to us, but all the utility folks out there. And then Representative Griffey's bill, I believe, is sailing right along as well, about county and city forces and working together. So those are just a few that we got going.
And Commissioner Netherland, you might want to take a look at 2174. Well, actually, both of you. It's crash prevention zones.
Yes, thank
so
you
that
for
might
highlighting
address
that.
your concerns on the.
Yeah.
Yeah, but take a look at that one. That one's of course, Wasac supports it, but it's a good one too. So take a look at it.
I don't know. That might impact our sheriff's office if we designate
There
it.
is a fiscal.
So Loretta, on that one and on that letter, let's talk about it for another second, because make sure, please, that
Yes, I'll say right in, right
But
out.
that they, no, but also that they say that they are informed that we're looking at 200 plus, possibly 200 plus
Oh, they're
on that, but that
aware.
separation thing that you brought up is what keeps going through my mind. Back in the day, we were requiring that on Taco Bell and Belfair. It never got done because of it. Accidents happened left and right. Then we ended up doing a fix at the county level. We put that barrier there in order to stop people from going in and out. I think we also need to say a barrier, because if not, then we're gonna have to try and do something else on state highway. We won't be able to. We need to be impactful, or we're letting people get hurt. A subdivision barrier on that right in, right out should be required, whether through our building code or something, because if you try to do it any other way, they're just gonna shoot across, just like they do already on the other side.
Well, even with what we have out front of Public Works, people
Still
still do
left,
that.
Well,
Yes.
we can't always stop stupidity, but don't let that
For
stop you
sure.
from making a smart
No,
choice in
I
our verbiage
understand,
to
but I'm just saying that
protect the
it's-
things that we can.
Yeah.
You know, we should be pushing to protect these people, not just, it's not our thing, or it's not, this is too serious, and the first one I lose because of it, I'll remember it for the rest of my life, I know, because it'll be my fault.
And then the other thing to keep in mind, so we have been meeting with DOT between planning and our building folks ourselves about phasing. So they're well aware of what is the potential up there and timing. And so a lot of the second access impacts have to do with phasing for the freight corridor itself, because then that will ultimately provide for another outlet out for that development up on top of the plateau.
So I keep wondering if you're better off trying to, because the second outlet is not even the second outlet off of the properties, it's almost a strange thing to have in there.
It's very similar to the couplet down below, basically, from,
Couplet.
well, the two different accesses out of the Olympic View and Olympic Ridge, and the business
Yes.
right there.
That was done,
Very similar.
but we're now facing it after the fact, and that doesn't work very well, I can assure you,
Yeah.
as we know. So we could be smarter when we do it in the beginning, that's all I'm saying. It just seems like an odd place, but if they're doing it, they ought to have something by law. I'm just not sure that it actually takes care of the reason why the law was put in there. Because it brings them all back to this one, why can't they just go use the traffic circle where it's safer, especially a couple hundred? If we're gonna have a bypass, it's gonna be a road going between that, then they come out on that side.
Yes.
But I'm just not so sure it's necessary, but I'm not gonna stand against it, I'm gonna sign on too. I just need that separation and the
Okay.
barrier, please.
All right. Anything for us, commissioners? All right, thank you.
Thank you.
Travis, you're up.
Yep, I'm gonna have Jen jump up here first so that she can get her sheriff's office out of here.
Not that we don't enjoy having them here.
No, but they don't need to hear this and all this, so.
Okay, good morning.
Morning.
So we just have the Washington State Association of Sheriff and Police Chiefs grant that was approved. We received this back in, I think it was July. We brought the agreement to you in September, and we've been trying to figure out the logistics of it. Trevor was gonna front it, I believe, and he ended up being out. So anyway, we figured it out, and there's 2 co-responders hired through ORS, and so this is just a formality to bring the grant agreement to you. It never got on the action agenda, so that's what we want to do, is put the grant agreement on the action agenda for the sheriff to sign, and then the ORS agreement, I had done it originally as a subrecipient agreement, but this is state funding, not federal, so I redid the agreement as a subcontractor agreement instead of a subrecipient, so it's just a cleanup. And we also want to put it into the budget because it wasn't put into the 2026 budget. So those 3 requests to go on the next action agenda for the regular grant, subcontractor, and then the budget.
money in, money out, not put in budget, or just money out, not put in budget?
We need to do money in and money out, and then,
That's good. That's a
yeah,
wash.
so it's a wash. There is a little bit of match on our end, but that's gonna come out of TST. So part of that grant agreement part of the budget will be putting the TST transfer in and out as well.
I'm completely comfortable with all that.
Okay, great, thank you. That's all that we had for you this morning. Thanks.
You did a great job.
You need to not talk quite so
I'm gonna
much.
say, the guy's got an issue with talking, man.
A man of many words.
Thank you very much.
Thank you.
See you later.
Okay, Mackenzie, you're up.
Oh boy. Well, I have a couple. One I didn't put on there, but I remember Pat mentioned at the beginning of the year, and I just kept forgetting, was adding a 5-minute time limit to the public hearing testimony. Is that something you were still interested in doing?
Absolutely.
But we wanted to make sure that it was a discussion before everybody.
5 minutes?
Can
Not
you
total,
check?
but for any one person.
Oh, okay, yeah. I was gonna say,
Sorry.
I remember when we brought it back, but see, back then it was a total war, and we had to gain control of it. We don't have to have control of it like we did in those days. I'm comfortable with that. But I was thinking, wow,
We
5
had
minutes?
2 people speak for 45 minutes at
Yeah.
the last public hearing. That's excessive.
Well, on
They
public,
lose it.
on public hearings.
I would check with
Yeah.
Tim first to
That's-
make sure that
I
we
did.
can. Did you? Okay.
I think
And
we
Tim said-
can, I just,
We can
it's
settle
just we
with it
never
as
have.
long as we
As long as we
announce
set
in
it
advance.
beforehand.
And we also need to include in the statement that written testimony is acceptable to be sent in prior to be put into the public record. It just becomes, well, number one, burdensome, but to get 2 people to speak for 45 minutes, you lose everybody in the room. It's like, you might as well not say anything, 'cause so we can check with Tim, we're allowed to put a limit on it, as long as it's consistent and we do it in advance.
I just had never thought about it before, not for the hearings. Everything else I get. I don't know, you mind if I just think about it for a week and just?
No, that's fine.
I'm just trying to play it all through, because sometimes people do need to speak, and if they don't, it turns into something else, and sometimes they need more than 5 minutes to be able to get things across.
Well, we can certainly change it to a longer number if we want. I don't care. I can tell you that.
No, I'm ready to do that. I'll meet you in the middle. If they can't say it in 10 minutes, they probably shouldn't be there.
They can't say it in 10 minutes, they should put it in writing, because they're
Well,
gonna,
that's
they're gonna
exactly
lose.
right. And they can put it in writing.
I've watched,
We put that in there.
yeah,
I can be comfortable with that, because
but they have a 3-minute time limit at the legislature when you're testifying, so
but I can be comfortable with that if you are.
we'll depend.
At least it gets started, it'll give us a chance
We'll put a limit.
to see how it works, yeah.
We'll survive if 3 people get up and give us 10-minute speeches, okay, that's fine, but
No,
45 minutes was, for
We're
2
gonna
people
always
was.
encourage them to say less. Not that we don't enjoy hearing everybody's.
Just 5 minutes can be awful hard for some, but I can see 10, we've done well so far, but there are times where it's unbearable.
And you lose people after a certain amount of time, so.
So are we comfortable
So-
with the 10 then? Put that?
Yeah, we'll start there, and if it seems like it becomes a problem, then we can back it down if we need to.
Okay,
But
perfect.
let's be consistent, set it in front, beforehand, so.
Yeah.
All right, and then my next item is the Northwest Event Organizers Contract. I did mention this last week. In the original contract, it states that the $686,000 is for the life of the contract. It's a 2-year contract, but it should be an annual amount of the $686,000. So that's, I know.
That's why you
big
choked.
number. Big number. So this is just amending the contract to state the correct
The intent.
Yeah, but if we're amending the contract, though, that's the same thing as changing it this time, we were talking about that. If we had a contract that was that over 2 years, and now we're putting a contract that's that every year, that is definitely not just a straight contract amendment. That is a allocation of funds that we're agreeing to.
When-
Which I'm gonna support what, you know, you're the person that sits on that, and I don't do that to you, you know that.
Yeah, the intent of the lodging tax committee was that it was a 2-year contract. The others are 1 year, because they're gonna come in and come up with a new funding allocation and everything else, and so, but the NEO contract was intended to be a 2-year contract at $680,000 a year. And I've also requested that anybody that receives funding has to come in before the commission to present, so that everybody understands what's going on.
Anybody over 500,000 must.
No, I want.
I was just
Yeah,
joking.
I want all of them to come in,
I was
because
just joking, 'cause
it's-
that's crazy.
they need to be responsible for the money that they're spending.
That was the intent, was to do that amount per year.
Right.
Yeah.
And so this is just.
And for
matching.
those in the public, just so they know, this commission does not designate where funds go with that money. We only can approve it or.
Or send it back.
That's
Yeah.
it. That's all we have for authorities on that, in case anybody's watching that.
Yeah, and I have started scheduling all the lodging tax recipients to come in to brief you guys to say, hey, here's what we're doing with that money. That way, there's just more.
Transparency.
Yes.
Yeah, and then let's also work on getting that meeting scheduled where they talk about how they want to restructure things too.
Absolutely.
Trying not to roll my eyes.
Absolutely.
I think it used to have no money in it.
I know, I know, well, when, we get the bulk of our money from, the VRBOs, the Airbnbs.
Yeah.
And so, it's hard for me when people say we need to restrict those.
Well, just, you know, I've never been in favor of restricting how many. I'm just in favor of having things in place that.
Restrictions.
Yeah, on it
Yes.
to protect the neighbors that are
Yeah.
around them and stuff like that. I don't wanna get into lottery and stuff. I always thought that was a failure.
Yeah.
And besides that, it always turns into favoritism. I don't care
Yeah.
what county you're at, what city you're in, it always turns into this person or that person. I don't want that. That's me personally.
All right, and then my next item is I did receive a request for concurrence from the Timberland Regional Library Board of Trustees from Lewis County to appoint Hal Blanton,
So,
which
they have never agreed on our request for our appointment. Not Lewis
Not-
County,
yeah,
Thurston
yeah.
County.
Mhm.
And so, I mean,
If
I like Hal. I
if
think
I
Hal would be
may,
great.
I spoke with 2 of the commissioners last Wednesday night at Wasac, 2 Thurston County commissioners. Our problem is with one county commissioner demanding that they not accept our thing. The 2 that I spoke to said, you know, we don't really care. So I said, we'll get one other one and ram it through and
Yeah.
we'll get this done.
Good.
I'm also gonna reach out to the one commissioner that they say is causing all the
I
problem.
know which one you're talking about too.
And see if I can't get them to just accept it. They both agreed that, yeah, we don't need absolute unanimous thought and
Shouldn't.
thought process, so the 2 that I talked to, they said, yeah, this is good.
Do we
The
still
truth
have
is,
one?
we're a little more conservative than some counties, and that's why it's our voice.
Yeah, and well, it's not just our county, and it's not just Thurston County. There's other counties involved in the Timberland Regional Library. I know that we did not approve Thurston County's because we were waiting for them to approve
Correct.
ours.
Correct.
So,
And we're still in that vote.
yes.
I can go either way on this one, because something's gonna give here shortly. It has to.
Well, I think Hal's a good person.
I reiterated with the 2 Thurston County commissioners, I said, we're not gonna let you push us around, just.
But now they have more than one seat on there, right? That's the difference, so.
Yes.
You know, we can thumb our nose at them, but they already have their voice in that room, we don't.
So, they said they're down to 3 board members. they need 4 for a quorum. They don't have a quorum right now. That's why
So
the
they should-
rush is on this one.
Yeah, that's,
And I said, well, you gotta approve ours. You know, I don't want it to be a problem between counties, but this is being unreasonable. So, I haven't gotten through to the last commissioner yet, but I will.
So what would you like me to do with Lewis counties?
I'm good with theirs. And Lewis agreed with ours, so they
Yes,
approved ours.
Yeah, the only one that didn't concur with our appointment was Thurston County.
I have no problem with this particular
Okay.
point.
Okay. And then I can reach out to my contact Rose with Timberland Regional Library. I can't remember the bylaws on whether or not you have to have concurrence from all counties.
I believe you do.
You do? Okay, okay,
I think so too.
okay.
But the one thing that's interesting is, you know, we also have to admit, it's the executive director that was making the phone calls to have it stopped. Well, I
At
know,
least according to the Thurston County, it's the executive director who said she's very strong-willed, and I said, then she'll have no problem dealing with our
I like her a lot,
nominee.
but I don't like the idea that the director, the one who's under the board, is making the decision on who. I think that's inappropriate.
Charisma?
No, this one, it should be clear, we're approving Hal Blanton.
Yes, Lewis County,
Yes,
Hal Blanton,
that-
yes, yes. And then the next item I have is bringing back the Memorial Hall rental policy and procedures. So I did make the amendments that Commissioner Netherland suggested. I just want to make sure that I got the wording correct, or make sure there weren't any other concerns or additions that you would like to make.
I thought it looked good.
And then I also did run the insurance information back by Nicole. She made a couple changes to that. I just wanted to make sure that we were on the same page.
I didn't get a chance. We made sure county and veterans were
Yes,
prioritized.
have priority,
That's what I thought.
absolutely. And then I made sure to include that the 501c3 organizations will be verified.
Yes, I like that.
Okay. I think you've stayed here long enough, Kevin.
Just for that, I didn't even say a word.
I'd say you stayed here for that, Kelly?
Would you like to add anything, Kelly?
Word from Jeff.
Dedication.
That's what- Not that we don't like your visiting us, but
Your presence is always appreciated.
yeah.
Okay, and I have 3 things, Commissioner. The first one is about the Mason County Citizens Commission on Salaries for Elected Officials. We discussed this last week. I've had Chris out polling the members to find out if we were going to need to replace any positions. It looks like we're probably going to have to replace one that falls under the commission decision, and then another one by lot. I think that's all that we'll have to replace, but by the rules, we have to go out and advertise for that for a couple of weeks to get those applications. So this just has a process in there. To
Do you have the
make sure
names of who's not?
What's that?
Do you have the names of who's not returning?
I don't. I have to ask Chris when he gets back. He's been making
I know
those
one.
calls. So.
Do you?
Yeah, previous commissioner.
Okay.
She's-
Oh, is she the one? Okay.
Yeah, her help is not.
Got you.
Yeah. So, anyways, this is just
That's
just a
actually what I was
briefing.
wondering about, actually, so.
Yep, I know.
Appreciate it.
Yeah, just briefing to let you know kind of where we're at, and then we're gonna get that advertised so that we can get that process going. Due to the schedule of the chair of that commission, we're kind of on a tight timeline because he's not available for much of April, which means we've kind of gotta get the ball moving. The one thing that is important to note is that we don't have to slow down the process of getting the commission up and running. We don't have to wait to fill those positions, we just need to fill the positions within that timeline. So we'll try to get them filled before we get the commission up and running, but that's not necessarily a requirement.
And you do have a quorum there, right?
Yes.
Do we need to take any action to release the auditor to do the lot, or is that something?
No, that's independent. of
Was,
that.
did we set those up by districts at all, do you remember?
I
And
believe
which-
we have, there's four, correct me if I'm wrong, there's
there's-
4 positions that that we appoint.
Yes.
The 3, so each one has one in their district, and then we have a floater.
Yeah, and she had property in both, which one
Right.
was she
Right.
from?
She was from 3, well, 3,
Yeah, she.
but she's got property in both, and
Yeah.
so that's why she was the floater.
Yeah, oh, she was the floater,
Mhm.
okay, that's what I was trying to figure out, okay,
Yeah.
so that's good. Okay.
Yep.
That's gonna make it a lot easier if we
Mhm.
don't have to worry about it.
Yeah.
Yep.
Okay, and then the other item I had was the State Route 3 freight corridor and the letter from the commission about the concerns about the potential timeline change under the governor's financial decision coming up. So just wanted to see if you all were in concurrence with that letter and want to move that forward for a signature.
Yeah. I wrote the letter, so.
Yeah. So, you might agree with it?
So,
Well,
I
and
support it.
the truth is, that's where it's gonna make the difference anyway, cause the governor can request whatever he wants, but.
Mhm. Yeah, well, and
So
then.
you concur with the way you wrote?
I do, I do.
Strange.
Yeah, and then also received a copy of an email that went to Representative Griffey from Wasatch, showing the timeline and what they've got scheduled, so it looks very promising that we're moving forward, so it's all good news.
I'm supportive.
I support it.
Okay, good.
Good job.
Okay.
Thanks.
Thanks.
And then the last item is a return to the Bremerton MOU to discuss the revisions that were requested last week by the commission. The request was to add language into the MOU. And I provided 2 options based on feedback that I received, as well as an attachment A, which was the P6 sewer service feasibility study. And I'm bringing that back for commissioner discussion on either of those 2 options and how you'd like to
No,
vote.
I'm good to my word, both of those take care of what we said, and I would go ahead and stand up there and vote for them. Just so you know, I'm the one that, you probably knows, I was adding the other words so that there's no confusion within 2 weeks or something like that. But both of them accomplish what needs to be accomplished. I prefer option 2, just because it just makes it just a little touch clearer.
I think I'd like to go to option 3, remove section I completely. I don't think it's in our interest to tell Bremerton on whether or not they have to have an MO or a feasibility study or not. We have one being done now, should be due March, I can't remember the date. It's happening through the EDC, which I reviewed what they're asking for, and it handles almost everything that's in that list. The other parts that it doesn't handle are being done by Public Works.
Well, as Commissioner Trask said the last time, we'd like to have our own control over our own issue. It is ours, this is the impact is to us. We told the people we would do this, I want to follow through with what we told the people. I also thought we had an agreement to go ahead and move forward again with this. I asked that we still stay by our words and what we said and move forward. I don't care which one, but just stand by what we told everybody and what we've agreed to. Besides that, it's all on us. This shouldn't be on us. They should, if we're gonna say they're gonna pay for anything, they should start by paying for the feasibility. But that's to relitigate that all over again. I want to just stand by what we promised, what we told everybody, and I'd be happy with either one of those.
Honestly, I just want to get this over with, get this done. I'm good with either option I or option 3. Either one works. I like option 1 or option 3.
It refers to section I.
Well, I'm good with option 1, like I said, and that's what we said we would do. So I'd still be up there and I would vote for it. We can stay together as we have.
I'm good with that. Let's just go with option 1.
All right.
Okay, so I will move it forward for the meeting next week with option one inserted.
Okay.
And this way staff knows what to do, and I just I feel bad for staff because we'll say one thing and then we change our minds, then we say another thing and then we argue and there's gotta be a better way, so if this helps staff go and gives them direction, then that's good.
I think, and again, it's hard for me to sit up there and vote for, but I will. And it's the right thing to do. I agreed to it. I gave my word. I'll stand by it and I'll take whatever meetings I gotta get for it. But it's the right thing to do.
Oh,
And it could be
you enjoy the
beneficial.
meetings.
Yeah, I'm gonna accuse of that, but who knows? It could come out with some great stuff that we don't know. We'll see.
Okay, it will be done, and I have nothing further.
Commissioner, anything?
I don't think so.
Yes,
I do?
we have the applicants.
Oh, actually, damn, we're getting some good applicants, guys.
I like both of them.
I do
think
too.
they would be.
I was impressed.
I would like both of them to be appointed to.
I'm almost getting nervous, feeling like we're supposed to be paying people like this to come on these boards.
Randy, don't even go
I'm
there.
just saying that both of those are professional. Oh, Commissioner, you might want to consider hitting her up for a position,
For a position?
attorney position.
I know, I thought of that too, but I don't know that she is.
Ask
I
her,
don't know.
give her a call.
Well,
You-
as soon as we get that posted,
Yeah, you get to tell her that, but even if it's not that, just maybe come here as an attorney.
yeah. So
I was impressed with both of them.
Yeah.
Yes.
Yes, on both of them.
Mackenzie,
So
yay.
send the message.
We got any more coming up the pipe?
Not that I'm aware of.
Oh, we have the position for the salary commission. How do you want to go about, just put it on our agenda to advertise for it through the meeting and,
Yeah, we'll start the advertising now. We need to get the timeline going, and then we've got hard dates in there for when the applications are due, and then when the review is and when the interviews are. So
and then you can do yours right away?
Asking people as well.
You can do
Yeah.
yours
You can
right
certainly
away?
get, yes,
Absolutely.
all the soliciting you
The
like.
lot, you can do yours right away for the salary
Oh,
commission?
absolutely, yeah. Typically takes about 2 days to find somebody.
Cool.
Well, I have another issue I'd like to bring up, which is different than all these. It has to do with this boating, negligent operations of boats. We took a ride out to Lost Lake in particular. And there's a boat that's been around forever and ever. It's a wake boat. It generates a significant weight.
Yes.
One that they actually surf behind without tow ropes. They don't go very fast, so it doesn't fall under any regulations. But if you look at some of the damage it does in any lake that has less than 35 feet of depth, actually at 35 feet, it is just still churning up the bottom a little bit. There's a massive amount of damage they're doing to our lakes. Lost Lake, there must have been a dozen trees that had fallen into the lake because it's just being destroyed. So there's a line in our code, 9.04.070, negligent operations. I'll just read the key sentence. Effects of vessel wake, and so as not to unduly or unreasonably endanger life, limb, or property. So I don't know I don't know that we need to change our ordinance, but somehow we have to figure out a way to
I do.
get this.
We've done this before, we've been through it before. One of the things that we can do, it's best to do it holistically and bring everything together. We look at all the lakes, but we can restrict those boats from that kind of lake. And we had this discussion
done this
before.
before, yeah.
And so when we did, one of the things we looked at is some of them are different. We can pick one and say no. We could pick all of them and say no. But if you've gone out there, and what you've just described is exactly what we're trying to stop, we did it. I would be open with the idea of restricting wake boats from that, but we should do it holistically.
We could do it, if we were to set the minimum lake acreage.
That's one of the things we looked at. Yep.
We could change that. Something.
Well, it's worse on lakes that are not as deep, so
Right.
that's
That's
one of the
true.
things we looked at too.
Depth, yeah.
Acreage and depth would be, because a very shallow lake would also
Yeah.
be destroyed by
That's why I say if we look at it holistically, but I think the last time it was the sheriff's department that put it all together for us, because we had somebody that was doing all that, Drogman?
Yes.
That, so I don't know if, we can lean on somebody that's doing that stuff now to come in and give us their opinions, allow the public to give a quick opinion. You'll find that they had a lot of opinion, didn't they?
Yeah.
But we can,
They did.
they're gonna want it at Mason Lake and stuff too, but Mason Lake is huge and it brings in a lot of revenue and,
It's deeper also.
yeah. So I'm very much open to that. Even when we did it, I think we all kind of agreed that let's see how it goes and revisit, so seems like it's a good time to revisit.
Yep.
It's better to do it now before the boating season
Let's do it.
comes
Yeah.
along. And so Travis was looking into how other counties restrict this. One of the comments that was made by the citizens who live out on Lost Lake was that people are coming from all these surrounding counties because Mason County doesn't restrict them, so they're bringing their wake boats in and
But at the same time,
destroying our property.
that was the idea of getting some of the revenue coming in too, but again, some of them are just too small. And, but enforcement is another story, but again, I wanna remind you, that will be part of the argument, we just can't enforce everybody, we can't, I understand that, but if the law is there, at least it can be enforced when they do wanna enforce it, and they won't follow it if there is no law there.
Right.
So, I'm of the mind of going ahead and putting something in, but.
Okay, well, as you find out more about it, we'll move it
Yeah, for
forward.
sure. I think, one, I had Chris doing a poll kind of across the state of, what was out there on the books and what that looked like. So, one, wouldn't mind finishing that and coming up with a couple options that would be appealing to you. And then, obviously, you would have to work with the prosecutor's office to ensure that it's something that they would consider to be enforceable or that they would enforce.
Are you still in connection with Drogman at all?
Oh, no, he retired.
I know, but I do, cause I'll bet you anything he has a folder, cause he had some of that stuff.
Oh, that's possible, but he would have left it with the sheriff's office, so
Oh, okay.
I can circle back around
Yeah,
with them. But
he did a lot of work. I mean, he was a champion in here for all kinds of aspects. He brought a lot of information, did a lot of work, so.
Check with DNR also, because they might have
Yeah.
something
No,
already.
let's just do it, we can do it.
The property damage that's happening, aside from the trees and the environmental damage, people are, the waves are so large, they're washing over the top of the bulkhead. And just dumping the $10,000 bulkhead into the lake. And it's just-
no, and it's not just shoreline. I mean, it destroys docks and just
Oh, yeah.
actual
Yeah, yeah,
physical
that
property
was it.
damage.
They look like a lot of fun, but when they're damaging other people's property,
We have the sound.
Yeah. They could still use it.
Go to Hood
And
Canal.
then
then.
wash the car out, or wash the boat out afterwards. Now, Sheriff is one of them, so he'll be in here too. He'll come and talk to us too.
Oh, but
He's an avid
He's
user.
very respectful.
He's only a ski boat. He has no interest in wake boats.
Oh, I thought he was doing wake boats too back in the day.
Ski boats. He likes to do his slalom skiing during the
Yeah.
summer, so.
And he's good.
all right?
Youth. Mr. Chair, I move we adjourn.
Second.
So move.